Hello, everyone. I'm Dr. Marty Ross, and this is another Conversations with Marty Ross MD tonight. As you know, this is a webinar where we're going to talk about Lyme disease. I'm interested to see what questions you have in store for me tonight, and hopefully we can make some sense of this thing and get some answers for you, and hopefully move your treatment forward as well, too. So for those of you that are new here, welcome. And there's a couple ways that you can participate. One is to listen to the questions as I read them. I will read them out loud. If you're in the live version, you actually get to see them on the bottom of your screen on the right-hand side of the screen. But if you are listening to the recorded version, you're going to have to, those don't show up, so you're going to have to listen to what I read here. And then the other way you can participate is write a question to me. And the way you could do that is on the bottom right-hand side of your screen is a chat box. You can write your question to me using that chat box. Keep in mind, as you do that, only hit the enter key one time when you get the whole question complete. Don't use your enter key to create separate paragraphs, because each time you hit the enter key, it sends a separate question to me, which gets to be hard for me to follow from my side. Keep in mind that I am never able to get through all of the questions. I know I get some people sometimes write me after webinars asking if I got their question and why didn't I get to it. Well, the truth is I can't get to everything. So we have an hour and a half, and I will try to get through as many of those questions as possible tonight, but I assure you I won't be able to get through all of them. Keep your eye out on tomorrow's email or tomorrow morning for an email that will announce that the recording of tonight's webinar is ready for you to see. You can also use that email to sign up for next week's webinar. And we actually are doing 3 webinars in a row here. So today, and then a week from now, and then 2 weeks from now too. Okay. So lots of opportunities here over the month of February. So why don't we go ahead and get started? I'll take the first question here. All right. Hello, Albert. Let's see here. Oops. Let's see. Hi, Dr. Ross. My son has these results on a real-time labs mycotoxin test after provocation. Ochratoxin A 3.058, trichocethine group 0.311, aflatoxin 1.013, gliotoxin 3.029, and zearalenone 1.307. Should he try to treat all of these at once or pick one and start with a specific binder for that first? Also, should he test his apartment for mold at this point and try to remediate it or focus on treating his body first? Any tips on home testing and remediation when you're a renter? I think some air purifiers can remove airborne mold spores, but do any purifiers remove mycotoxins being generated by mold spores that aren't airborne? All right. So there's a lot of parts to your question here, and let me see if I can kind of break it down. So first of all, when I see a picture of somebody that has multiple types of mycotoxins that are elevated, I try to pick a general binder that will cover a number of different mycotoxins, okay? And so one way to do it, you could use the prescription cholestyramine, which can pick up a number of different types of mycotoxins. Another one would be to use a product, an herbal medicine product like a GI detox by Biocided Botanicals or Mycopole by Research Nutritionals. Both of those have multiple components to their binders that can go after a number of different mycotoxins, okay? So you could either use the cholestyramine or you can use the supplements. I prefer to go with the supplements though, and the reason is cholestyramine tends to lead to constipation. I find that a Mycopole or a GI detox do not, okay? So you can go after all of these at the same time, all right? Now, when I get somebody so keep in mind with mold toxicity illness, the mold toxins that are trapped in your son or in a person may be from a current exposure, or they could be from old previous exposures, all right? And the problem is it's really hard to tell sometimes. If you are living in a building full of mold toxins, though, it's going to be hard to recover. And so I usually suggest to my patients that they get a mold inspection done at their home and possibly of their workspace environment to make sure that they're not getting exposed toxins currently, because if they are, it's going to just really be difficult to get over the illness, okay? So let me explain a little bit about mold toxin so you can understand why I'm talking about it being something you could have been exposed to in the past or due to current exposures. So there's about 25% of all people have a genetic profile where when they breathe in mold toxins from the world around them, those mold toxins get trapped in their bloodstream and they can't get out. What happens in 75% of us is we could walk into a building full of mold behind the walls and be exposed to all kinds of mold toxin cloud, if you will, breathe the stuff in, and it'll get absorbed into our bloodstream through our lungs. And then once in the bloodstream, some parts of our immune system will come in and tag those mold toxins, and then other parts of the immune system will come in and break those mold toxins down. Okay, so that's what's supposed to happen and is what happens in 75% of us. We can go into a building full of mold toxins, our immune system works to break them down, and we never have problems with them again. But in 25% of people, we can go into a building that has mold behind the walls and mold toxins, we breathe them in, and they literally get trapped in us, all right? So the issue is, when did you get your mold exposures? Is it coming from your current environment? Is it coming from the church that you went to? Is it coming from your old work environment or a number of your old homes? And basically over time, you've just built up a problem. And so it could be that even if he does get his home environment tested, or he gets his work environment tested, and he finds that there is no mold there, it probably would mean that these are old exposures. However, again, it's really hard to get over mold toxicity if you're still living in a toxic soup. It just is, all right? It's not possible, but it is very difficult to do it. So I would go ahead and try to get a home inspection done, and even a work inspection done, possibly, okay? Now, with apartments, often if there is an issue with potential mold toxicity, often you can get the landlord to do it. They don't want to face lawsuits of having you live in an area that's poisoning them, basically, all right? So you might want to approach the landlord and say, hey, we've got mold toxins going on. We want to have a testing done in the environment. If they don't do it, then you may just need to have him pay for it himself and get it done. And if they are on there, then you can show that to the landlord, because the landlord's going to need to do some remediation then too, okay? And then let's see here. Yeah, I don't have good things for you. I mean, I've actually had some mold exposures before in a building I was renting, and I had actually got the inspection done myself, showed it to my landlord, and fortunately, the landlord made good on it. They didn't want to have this become public that they were renting out to a facility that had bad mold in it, basically, okay? And then, let's see. I think that takes care of it for you there. Anyhow, good luck with your son, all right? And thanks for the question. Hello, Jake. Hi, Dr. Ross. I must say that your online supplement store is amazing. Great. Thank you. I appreciate you saying that. For those of you that don't know, my store is called Marty Ross MD Supplements. And basically, it's the same supplements I offer to anyone that I use on my patients at my practice called Marty Ross MD Healing Arts. So anyhow, thank you for that. Let's see. Will you be continuing to run the store even after you stop seeing patients this year? Yeah, I will. In fact, the business is what I'm going to keep doing is running my store. I'm going to keep updating and adding to my Lyme disease information site called Treat Lyme by Marty Ross MD. I know you're all familiar with that, but yeah, I'm going to keep that one going. And then I'll be writing more books. Many of you know I just published my latest book. It's out now, and you can either get copies of the book through my supplement store if you want to not have to pay for shipping. And as long as it's a total order of $50, I cover the shipping for you, and there's no state sales tax. Or you can get it from Amazon, and you can even get a Kindle version through Amazon as well too. But that book is out. But I plan on writing more books. All right. And then finally, the other big thing I'm going to be doing is I want to set up 2 online communities, one for people living with the illness, and another one for physicians that are just starting out that need extra support, learning how to treat Lyme and feel better working with another group of physicians that are doing the same thing. So I plan on introducing somewhere in probably April or May of this year an online support community as well too. That's probably going to be a subscription community because I have to put a lot of resources into doing it. And if people want to participate in that community and get more direct advice from me, there's going to probably be a subscription fee that's going to go along with that. And I'll be setting one up for providers as well too. Okay. And then let's see. I noticed that you sell a product called Elimicand from Research Nutritionals. It looks like this product is used to treat yeast. I know that you normally recommend other things to treat yeast, such as Phytostan. Do you ever recommend using Elimicand, and how does it compare to Phytostan? Also, what is the typical dosage that you could recommend for the Elimicand? Also, would you recommend using Phytostan and Elimicand at the same time? All right, so let me just do a quick screen. Well, I can't do screen shares, unfortunately. I'm on the road right now. I'm not in my office. On my desktop, I can actually do screen shares. For some reason, on my laptop, which I'm using right now, the screen share function doesn't work. But I'm going to go ahead and while you're looking at me, I'm going to look at my store and the ingredients that's in the Elimicand. So hold on just a minute. So Elimicand is a new product from Research Nutritionals. It's an herbal supplement that has a number of things in it to help treat yeast. That is what its main function is. And let's see here. The key ingredients in this are, so it's got cinnamon, clove, marshmallow, powder coal, slippery elm, berberine, and Stellengia. It looks like a typical dose on this is going to be working up so that you're taking a full dose is going to be 40 drops in the morning and in the evening. All right. So anyhow, you look at my supplement store, it gives you a process to ramp up to that. So in terms of the ingredients that are in this, the cinnamon, the clove bud, the marshmallow root, powder coal, the slippery elm, berberine, and Stellengia, this is something you could mix together with a Phytostan. Phytostan has a little bit of powder coal, but a small amount, which is also in the Elimicand, but it also has in it some caprylic acid, some rosemary oil, some thyme oil, and some undulacinic acid. And so the majority of the components that are in a Phytostan are not in the Elimicand. So it's possible you could mix those two together. I'm not sure you need to. Usually what I have people do before they start trying to do multiple products is to basically try to see how you do with one. You might do well enough just with the Phytostan. You might do well enough just with the Elimicand. Give those a try for about a month. And if you're not getting far enough along with your yeast symptoms, then I would go ahead and try to add the second one if you want to do that. But I don't see any reason you couldn't mix those two products together. Okay. All right. Thanks for your question, Jake. Hello, Shanna. Let's see. Can you give us liquid tinctures or chewable options instead of pills? It's difficult for me to swallow capsules or pills. So, Shanna, if you note, it depends on what purpose you're trying to use the pills or the liquid, but all of my herbal antibiotic recommendations that I have are all liquids. They're not pills. In terms of some of the other supplements I offer, I don't have liquid varieties of those, unfortunately. I haven't found good quality ones, but when it comes to the herbal antibiotics, if you look at any of the recommendations I have for how you treat Babesia or Bartonella, et cetera, I offer a variety of different herbal antibiotic tinctures. They're liquids, and I carry those at my store too. So if you look at if you go to my store, which is Marty Ross MD Supplements, the URL is treatlyme.com. All right. And there's a big drop-down mega menu that you can find. If you look under a tab called Montana Pharmacy, you'll see the variety of herbal antibiotics that I carry in my store. Okay. And they're all tinctures, basically. All right. Thanks for the question. Hello, Sita. Let's see. Which over-the-counter methylene blue brand would you say is most efficacious and also reliable? Can you talk about the many benefits and uses of methylene blue, potential side effects, and contraindications? Thank you. So first of all, I'm not familiar with any of the over-the-counter varieties of methylene blue. When I'm using methylene blue with my treatments, I'm trying to go pharmaceutical grade because I think it offers the better chance of helping a person. I think there's better quality controls on it. And so I tend to use, I'm using my methylene blue through compounding pharmacies. I used to use a lot of it from Hopkinton Pharmacy in Hopkinton, Massachusetts, but they recently sold their compounding business to PD Labs out of Cedar Park, Texas. And so, they seem to be offering a good quality product as well too. So I tend to use either one of those. I have used InfuServe products before out of Florida. Any of those would be fine. In terms of methylene blue is designed actually to do what it's made for has nothing to do with infections. Okay, so what it's initially approved for and made for is to treat a condition called methemoglobinemia. In methemoglobinemia, the hemoglobin protein in the middle of your red blood cells that kind of grabs onto oxygen and helps carry oxygen around your bloodstream. In methemoglobinemia, the hemoglobin doesn't let go of that oxygen, especially when somebody's under stress, medical stress or oxygen need stress, all right? And so what methylene blue does, it has the ability to bump the oxygen off of the hemoglobin and help people that are in crisis. And so it's manufactured for that situation as in an IV form, and then to make it into something that's usable for in a pill form, it has to be mixed up by a compounding pharmacy. Okay, all right. From a medical standpoint or from a germ standpoint, which is the main reason I use it for, I don't use it for other purposes. I use it to help people that either get methemoglobinemia because they're using a dapsone. Dapsone can lead to methemoglobinemia. Many of you may be familiar with Dr. Horowitz and his dapsone Lyme protocol, but that dapsone sometimes can lead to methemoglobinemia. Okay, so I use it sometimes with my patients that I'm using dapsone on. If they start developing signs of methemoglobinemia, meaning they are turning blue and they seem oxygen starved, then I'll wind up using some methylene blue. I may even have them on methylene blue on an ongoing basis to help prevent that from happening. Okay. But the other thing that methylene blue can do is it can help, we think it works by destabilizing, it gets into the covering of germs and it can destabilize that covering of the germ. So for it to kill bacteria, it doesn't need a growing bacteria. It can kill growing bacteria, but a bacteria cannot be growing and it will still work by destabilizing the covering of the germ. And so I like using it as part of my Lyme and Bartonella treatments, mainly as an agent to treat persister Lyme or Bartonella. So many of you may be familiar that the current in vogue thing that many of us are trying is for our patients that we have a hard time getting over, or one of the things that we think may be keeping people from getting well with Lyme and Bartonella is that a certain portion of their germs move out of a growth state into a hibernating, or we call that a persister state. And it may be these persisters that keep people from getting well. Now, it's an in vogue idea. It's a current thing we're all trying. We'll have to see if over time, if it proves to be the thing that really does make the big difference for people. I think it does, but we'll see. We'll see over time. But anyhow, I like using it to help treat my as part of all of my regimens these days, whether for Lyme and for Bartonella, I put people on things that will deal with the growing aspects of the germ, but also with the hibernating or persister aspects of the germ. So I tend to use methylene blue as one of the agents I can use to treat persisters. Okay, all right. If you're looking for, unfortunately, I can't do a screen share here, but there's many other ways to go after persisters besides methylene blue. If you are looking for a way to do that, go to my Lyme information site, Treat Lyme by Marty Ross MD at treatlyme.net. And on the search bar up at the top, you could put in persister, Lyme, and Bartonella, and you'll find the article that I've written that specifically addresses what do you do for persister, Lyme, and Bartonella. Okay, all right. Other agents I like using are cinnamon clove oregano capsules. That tends to be my go-to agent. It's less costly than methylene blue, less messy than the methylene blue, and does a good job of treating growing and persisters. Other herbal options could be cat's claw, could be Japanese knotweed, and could be cryptolepis. Cat's claw is good for persister and growing Lyme. Probably doesn't have any activity against Bartonella. The cryptolepis, which we traditionally use for Babesia, actually can treat growing and persisting Lyme, growing and persister Bartonella. And then Japanese knotweed can treat growing and persister Lyme, growing and persister Bartonella as well too. Okay, so take a look at that article. You see I walk through the various ways that you can use those herbs to deal with persisters. Okay, all right. Thanks for the question. Hello, Lan. Let's see. If I have elevated mycotoxins in real-time labs, does that mean I am necessarily one of the 25% of people who can't process mold toxins? Or is it possible that I have been exposed, but it's not going to give me problems? Also, taking berberine enhances olive leaf extract, or let's see, also taking berberine, echinacea, olive leaf extract, or skullcap gives me pain, and you suggest it might be a herx rather than a sign of Th1 dominance. I don't have Lyme anymore, but could any of these cause a herx due to mold toxicity? You know, I'm not aware of those killing mold spores or triggering something that would lead to a herx or cytokine surge in mold toxicity. I'm not saying it's not possible. I'm just not aware that it would wind up doing that. In terms of mycotoxicity, in terms of anything we do, a test is only as valid as the symptoms that you have. So if you test positive for something, but have no symptoms of that thing, then it's possible that that test is a false positive, okay? So I don't treat a test. I treat a person that has symptoms. And when they have symptoms, I'm looking for causes of those symptoms. But if we do a test and it comes back, if somebody comes to me and some other doctor has done a test, they did mold toxin testing and they're 100% well, and yet their mold toxins are elevated in that test, I'm not going to do anything for it. Either it's a false positive test or their body is dealing with it. Somehow their body is dealing with it. Okay. So that's my philosophy on that. All right. Thanks for the question, Len. Hello, SJ. Let's see, to deal with mast cell dysfunction in the form of digestive issues, when you have high inflammation, fluid in the ear, is it advisable to take high doses of Areva, then histoquel, quercetin, antifactor, glutathione, all at the same time, and then add a peptide like KPV or BPC157, have significant mold infection as per real-time results? Boy, you're asking me to diagnose and to recommend treatments for you. I can't do that. I can talk generally about things, but there are some of my patients, I might do all of these at the same time. There's other patients of mine, I might not, because they may not need all of these things at the same time. So it's kind of hard for me to answer that question without knowing a lot more about your health status, what ongoing health problems you have, what kind of health issues you're dealing with. So I'm not going to be able to answer that for you, unfortunately. Good luck to you. Hi, Mary. Let's see. What tests for co-infection, especially Bartonella, do you recommend? Thank you. So for Bartonella, there's a number of tests that are out there. My preference these days is to go with the IGenex test, which is called an IGenex Immunoblot. So what happens with an Immunoblot method of testing is we're actually looking to see, has the immune system made antibodies against Bartonella? And the way that IGenex does their test, they look to see if you have antibodies against 4 strains of Bartonella. But then, oops, boy, my face is falling off here tonight. Oh, well, anyhow, I guess I'm going to make that worse. At least I got, anyhow. Darn it. Oh, well. I should have paid attention a little bit more tonight before I got on the screen here. What am I? Anyhow, I've got a condition called seborrhea that sometimes acts up. It looks like it's acting up here tonight. Anyhow, so in terms of the Bartonella, again, with the Immunoblot, we recognize that there are 15 strains of Bartonella that can infect people, okay? And we want to do a test that has the potential of picking up all 15 strains. Now, IGenex method can actually detect antibodies against 4 specific strains and against the whole family that makes up Bartonella, all right? So if you get the family test back positive and the 4 specific strains are negative, it means you got one of those other 11, all right? All right, so I prefer using them. They have a sensitivity, the ability to find an infection if it's there based on their validation studies of about 90%, okay? So it's not perfect. I'm also looking at the symptoms a person has, and if they have a lot of raging symptoms of Bartonella, I'm gonna treat for Bartonella even if the testing is negative, okay? All right. And many of us that treat Lyme, that's what we're gonna do, is we're gonna look to see, do they have symptoms suggesting the illness? And even if the testing is negative, we might treat anyhow. All right. Now, the other lab out there that's doing a lot of Bartonella testing these days is Galaxy. And Galaxy has a good test, but we don't know how good it is at finding the germ when it's there. And what their test is, it's a test called a PCR test. And what a PCR is a technique we use to amplify the DNA of a germ. All right. So if you happen to find the DNA of Bartonella in you, it really is in you. Versus if you come up with an Immunoblot that's positive, it just means you have an antibody reaction against the Bartonella. Your immune system may have gotten rid of it and still be making antibodies, okay? However, the problem with doing PCR testing is that you're drawing a blood sample, and to detect the Bartonella, some of those Bartonella germs have to be swimming by the needle at the exact moment you draw the blood. So it's like finding a needle in a haystack. In fact, Bartonella doesn't necessarily readily live in the blood. It tends to live inside of cells, okay? So we don't really know, and even Galaxy has not done testing to determine how good are they at finding all Bartonella when it's there. When their test comes back positive, it really is there because it's hard to refute that you've got the DNA of a germ in you, okay? But it's not necessarily the best test at finding it in the most number of people. For that, the fact that that IGenex has been able to show that their sensitivity, their ability to find the germ when it's there is 90%, is probably the best that we've got out there, okay? I know also that there is Infectolab Americas that's doing another test, which is called a Elispot, also known as a T-cell activation test. So T white blood cells are a type of white blood cell that can fight infection. And if your T white blood cells have a lifespan of 2 months, so if they react against a germ, that means that germ has been in you sometime within the last 2 months. Okay, so in theory, all right. So the way that the Elispot T cell activation test is done is we draw your blood, we take your T white blood cells, put them in a test tube, and then we take some proteins from Bartonella in this case, and we look to see if we introduce those proteins into this test tube, do those T white blood cells release a bunch of cytokines? And we measure them. And if they make a bunch of cytokines, that means they have seen the germ sometime in the last 2 months, basically, okay? Now, that sounds good. The problem, though, with with any T cell activation test is it can be wrong about 15% of the time. All right, that's what just the general rate of accuracy with T cell activation test is. But then there's a bigger problem, and that is the way that Infectolab and even Armin Labs out of Germany is doing their T cell activation test. They're only looking to see if you react against Bartonella henselae, not the 15 different strains that you might have. Okay, now the IGenex Immunoblot is looking to see if you have antibodies against the whole family, so it can see if you have antibodies against the 15 kinds. Okay, and the Galaxy, their PCR test actually looks to see if you have, they can detect the DNA of 15 strains as well too. Okay, so those are your broadest tests. But of those, the one I think that has the best ability to find it on average is going to be the IGenex test. Okay? All right. Thanks for your question, Mary. Hello, Joyce. Let's see. Thank you for your dedication to these webinars, Dr. Ross. You're welcome. Let's see. I've had Lyme, Bartonella, Babesia since 2001, Doxy at diagnosis in 2001, and more natural treatments since then. I have followed your protocol for the last few years and currently take herbs for Lyme and Bart. Back in October, I got the flu and was extremely sick for 2 weeks. I did not go to a doctor as the day I got sick. My boyfriend went to the ER and was diagnosed with multiple myeloma and admitted. My grandson was rushed to the ER and intubated, and my world was crashing in on me. Goodness, that's a lot. I'm sorry to hear that. I broke out in a pin dot rash on my thighs. Within days, the rash traveled all over my body, but presented differently on different parts of my body, from red pencil eraser-sized dots on my chest to ringwort type on my rib cage to raised tiny pink bumps on my back. All have subsided over time, but the back somewhat lingers. To add to the misery, my hair is falling out in clumps. To date, I have probably lost 1/3 of my hair. I have also had copious postnasal drip. So, Joyce, let me see if I can find a second part to your question here. Is very uncomfortable. I'm trying to figure out if this could have been COVID or the flu on steroids due to all the stress in my life. I'm doing my best to cope at eating well, but sleep and exercise are suffering. Have you seen these symptoms with Lyme? I had been in touch with my family practitioner, but she offered no answers. Thank you again for always being there. Joyce, I don't know. I would want to have seen, rashes are tricky, right? I mean, you've got to see them. And I would want to have looked at those rashes to see what they looked like, to see if I could get some clues from that. I will also tell you, when you're under extreme stress, you can get allergic type rashes or eczematous type rashes, or you can get hives that might come up as well too. So I can't tell what this was without having been able to participate in looking at you at the time that everything started happening. I will say I'm sorry to hear all the stress you've been under. That's just huge stuff that's been going on in your life. But I'm afraid I'm not going to be able to give you a good answer for this tonight. Okay? Sorry about that. Hello, Pete. Let's see. Do you have any suggestions for topical relief for Morgellons lesions that can create itchy small welts well beyond mosquito bites, more along the lines of poison ivy? I don't think it's shingles, but I'm not positive. All right. So everyone, Morgellons is a type of rash that people can get. It often can cause a lot of itching. People sometimes describe having fibers come out of it. It can have these red areas, it can have little dots. And we tend to see it, if you're ever interested, I would look on the internet, just Google Morgellons and you'll find images of what Morgellons rashes can look like. When we tend to see about 90% of people that have Morgellons have Lyme. If somebody comes to see me for Morgellons, the first thing I want to do is a Lyme test to see if they have Lyme, okay? The other 10% are people that have HIV and AIDS, actually. And so we tend to think that people that get Morgellons have some type of immune suppression. Morgellons may also be a skin manifestation of Lyme. If we look at these lesions and we look at the filaments and we look under the microscope, we can't tell what they are. It may be that some of these lesions are being caused by normal germs that live on your skin, like funguses and bacteria, causing irritation of the skin, okay? But one of the other things that could be happening, especially if you're getting welts here, is that on top of Morgellons, you may have a condition which is basically allergic type skin reactions to scratching. And so you can, if there's a condition, an allergy type condition called dermatographia, where you scratch yourself and you get welts just from that alone, okay? And it's a strong histamine reaction. Now, when you have Lyme or you have mold toxicity, sometimes that can lead to overactivation of your mast cells. And we call that mast cell activation syndrome, okay? And so the approach that I like to take for my people that have allergic type conditions, like with welts, one of the things I like to do is to, first of all, de-stress. Stress is one of the biggest things that will turn those on. Number two, I like to have people do something to stabilize their mast cells as a starting point. And the herb that can stabilize your mast cells that I like using up front is quercetin. It comes as a 250 milligram pill. And I usually have people take 500 milligrams 3 times a day. If that's not effective enough, then I might add to that the herb called luteolin, okay? I also have people try to eliminate from their diet or from their environment things that they know that sets this off as well too. In terms of treating Morgellons, the thing that we like to do to treat Morgellons is actually treat the underlying infection that's leading to the immune suppression. So Morgellons and Lyme, the Morgellons will often get better as you get Lyme taken care of. I have not found any topical agents that really work well. In other words, there isn't anything specifically you can put on the lesion that seems to help. What helps is treating the Lyme infection, and over time, those lesions will get better, okay? All right. So anyway, that's what my approach is, treat the Lyme. That's what I do, okay? All right, good luck to you. Hello, Brandy. Let's see, which infection has immune suppression capabilities? I feel like my immune system is only passively cleaning up, but it's not aggressively attacking what I have anymore. So, Brandy, any of the infections could potentially lead, any of Lyme and any of the co-infections being Lyme, Borrelia, Bartonella, Babesia, Ehrlichia, Anaplasma. Well, actually, Elimicand and plasma, if you just get on Doxy for about 2 weeks to a month, you've taken care of those. Those are fairly straightforward to take care of, okay? But your Bartonella and Babesia, those could be triggering some immune suppression as well, too, okay? All right. Good luck to you. Hello, Duke. Hi, Dr. Ross. I've been diagnosed for Lyme, Bartonella, Babesia about 3 years ago. Before I started treating Lyme, I was suffering from severe OCD and anxiety. These both improved significantly after our treating with the herbal germ killers. However, even after 3 years of treatment, I still have some OCD and anxiety left. Are there any peptides or other supplements that can help repair brain problems that caused OCD? Would Cerebrolysin by integrated peptides be a good thing to try for this? Thank you for all the great information. All right, so When I see somebody with OCD and anxiety, I'm tending to think of it as being, and somebody has Lyme disease, I'm wanting to know if they had Bartonella. And you identified Bartonella here. So you tend to see a lot of more severe psychiatric issues if Bartonella is there and Lyme is there, okay? And so, treating Lyme and getting those under control often can help. Now, it is possible that your OCD and anxiety that's left has nothing to do with Lyme and Bartonella. It's possible. It may just be you, for instance, okay? But I understand from your question, you're not thinking it is. You're not thinking this is an underlying health problem that you have. If I were to think about, in terms of your question about what can repair brain injury that might be leading to something like this, I would first probably start with a BPC 157. So BPC 157 is a peptide that we tend to think of the Swiss Army knife of all peptides. It can repair tissue damage, whether it's muscles or nerve tissue damage. It can stabilize mast cells to a degree, although I like the peptide called KPV. It's stronger for that, okay? It can balance your immune system, and it can help your mitochondria cell energy factories work better as well too, all right? So I usually will start somebody on that at 1 pill twice a day, sometimes go up to 2 pills twice a day. Try it for about 1 to 2 months. And if we're not getting far enough with brain type symptoms, whether it's an OCD, anxiety, or whether it's cognitive difficulty, thinking difficulties, then I might add in some Cerebroprep, and I would do that as 1 pill twice a day on that and give it a month or two to see if it's going to help, okay? But I generally like using the BPC 157 peptide as my starting point and then add to it in situations like this, okay? So for those of you that are not familiar with peptides, we think peptides are naturally occurring amino acid substances that our body makes on its own. And we think that there are over 100 or more peptides that are made. One of those is when I say amino acid complexes, what I mean by that is you may be familiar that proteins are made up of amino acids. The Food and Drug Administration has come up with this artificial designation that says if you have more than 40 amino acids together, that's called a protein. If it's less than 40, then that's, or 40 or less, then that's called a peptide. Right? It's just an artificial designation. So there's a number of them that are made naturally in our bodies. Cerebrapep is made up of a peptide called Cerebrolysin, okay, which is useful for traumatic brain injury, whether it's head injury, infection injury. It can be useful for those situations to do the repair of that, okay? And then in the stomach lining, there is this peptide made called BPC 157. And the reason it's made in the stomach lining is it's supposed to help promote good intestinal health, intestinal repair, okay? But it was discovered years ago that it's very useful at treating athletic injuries and helping in situations like that as well too, okay? And so anyhow, I have a whole article on peptides. If you just go to my treatlyme.net website, Treat Lyme by Marty Ross MD, and just write peptides in the search bar, you'll find my peptides article where I walk you through the various oral peptides that are available at this point and suggest a strategy for using those as well too, okay? All right, good luck to you, Duke. For those of you that also be aware, there are majority of peptides are actually intravenous, but there is a company called Integrative Peptides that is working towards manufacturing a number of oral ones. And I carry those at my supplement store, at Marty Ross MD Supplements. If you just go there and put in my drop-down mega menu there, you'll find the Integrative Peptides tab, and that's where you'll see the various oral peptides that I carry, okay? Hello, Owen. Let's see. What are some of the strategies you use for the different types of anemia? It appears that many pathogens like to use iron, and a defense strategy, your body will actually find up iron to keep it away from the pathogens. Thank you. I'm not so sure that's a right way of looking at it, Owen. So when somebody has anemia, there can be a variety of reasons for it. And so the first step that we'll wind up doing is try to figure out why. What's the cause of it? Okay, so the initial thing that we'll look at is the CBC, and which is your blood count. And we'll pay attention to an indicator they're called an MCV, or mean corpuscular volume. Okay, so what the MCV tells us, it gives us an idea of what's the size of your red blood cell. All right, if your MCV is small, that is something we'll see with iron deficiency anemia. Okay, if your MCV is large, that sometimes is something we'll see if you have low B12 or low folate leading to the anemia. Okay, so those are some of the metabolic causes. All right, so look at that MCV. If it's low, check your iron levels and check a ferritin level. Ferritin is a storage form of iron. If that MCV is large, then you want to do a folate and a B12 level. Okay, I have not seen anything that says the germs tie up iron. There's no science that supports that. If you have found some science, send it to me. I'd be glad to take a look at it. I suspect that's more of an opinion that some people have, but doesn't have any scientific foundation behind it. Okay. And one of the other things that can happen when you're treating Lyme with either herbal antibiotics or with prescription antibiotics is some of these things can suppress the bone marrow. Your bone marrow is your red blood cell factory, right? And if it gets suppressed, then you're going to have a hard time making enough red blood cells. And so sometimes people will have anemia because they just have a hard time making it, basically. Okay. So anyhow, that's so when somebody comes in with low blood counts, first thing I want to do is look at the MCV. If it's low, I check ferritin. If it's elevated, I check a B12 and a folate. If it's normal, sometimes I'll check a ferritin, a B12, and a folate because you can get a mixed picture on that. And if those are all normal, then I'm going to look at the drugs that I have somebody on and start wondering, am I suppressing the bone marrow? Okay. That's generally what my approach is on that. All right. Good luck to you, Owen. Hi, Mark. Hi, Dr. Ross. I have been very ill for over a decade and never had clear test results until I had the IGenex Immunoblot testing. It was positive for tick-borne relapsing fever, Babesia tacani, Bartonella cantana, and Elisabethii. The Bartonella has been my biggest issue over the last 1 to 2 years. I recently started your Bartonella herbal protocol and have already noticed significant improvements, despite significant hurting. Is it common to have 3 different strains of Bartonella? And if that is abnormal, are there other things I should add to the protocol to help cover myself? Thank you so much for all you do. You know, it's a good question. So many of you may be familiar. I just launched or announced that I had published my book, even though I published it 3 weeks ago. But I finally got enough my copies that I can sell it on my store yesterday. So I made a book announcement yesterday for my new book called Hacking Lyme Disease, an Action Guide to Wellness. And that book is basically a compilation of 40 of the most essential articles from my website to help you manage Lyme disease. And when I posted on Instagram that I had just released this, a woman wrote and saying, God, I hope this isn't just herbs because we need the big stuff. We need something to that effect. We need the big stuff. We need prescription antibiotics. And I responded to her, but what I responded to her is that, you know, it's my book and my articles on how to treat Bartonella discuss using both prescriptions and herbs. What is interesting is people, and I see this in my practice, what I find is that prescriptions work better than or prescription antibiotic protocols will work well for Bartonella about 80 to 85% of the time. Any combination you put somebody on has an 80 to 85% chance it will work. So we have one combination doesn't work, you switch to another one and it may work, okay? Herbal antibiotic combinations, I tend to find work about 70 to 75% of the time, all right? But here's the caveat on that. Here's the warning on that. Just because herbs don't work as well on average as prescriptions, and in any individual person, they might be the way, right? So if you've done prescriptions for a while and suddenly you go on herbs, it just may be that your germs are going to respond better and that you're a person better designed to have benefit from herbal antibiotics, okay? In terms of why you would have all three of those, I don't know. I have not seen a picture like that before. I've seen people that have two different strains. I haven't seen a picture where somebody has three. I'm not sure why that would have happened to you. Okay. I don't think, though, that you need to do anything more because you have different strains. I just think you need to be on something that's working. And it sounds like if you're using my protocol, which would be the Cidacuda, Hutania, and I also do suggest using the liposomal cinnamon clove capsules, it looks like it's working for you. Okay. Now, keep in mind, if your previous prescription antibiotic protocol for Bartonella didn't work, not all prescription combinations cover for persisters. All right. So I mentioned that earlier tonight. We now think that's one of the reasons that people don't get well in this illness is they have growing forms, and the prescription antibiotics generally work well for growing Bartonella, for instance, but they don't do that well on the persister side. And so we've got all this science going on now looking at what are we going to use for those persisters. And what we're finding useful for persisters might be a methylene blue. For Bartonella, that is, might be a methylene blue, not disulfiram. Disulfiram is probably only good for Lyme, okay, but methylene blue would be the prescription, and then herbs. The herbs that seem to do well against persister Bartonella are cinnamon clove oregano capsules, a Japanese knotweed mite, Cryptolepis mite, and those are some things that I'll have people try. And I work with combinations of those. Sometimes I will use the methylene blue as well too, okay? But if your previous treatments didn't work, it may not be that you weren't on any, it may be that you just weren't taking something to deal with the persisters. And if you truly are following my protocol, which is Cidacuda, Hutania, and the liposomal cinnamon clove oregano, it's the cinnamon clove oregano maybe making the difference because it's covering for persisters where maybe your previous treatment it didn't. Now, I don't know. I'm just postulating here. I don't know exactly what you were on before. Okay. All right. Glad you're getting better. And no, I don't think you need to do anything extra just because you've got all these different strains. Okay. All right. Good luck to you, Mark. Hello, TJ. Let's see. IV versus oral antibiotics. It seems anecdotally from users around me that they seem to be more powerful and effective. Is that the case in your experience? You know, it's interesting. When I first started managing Lyme disease back around 2004, 2004 would have been my first patient. At that time, the number of doctors treating Lyme were predominantly on the East Coast, okay? And there was an East Coast way, which was to often go with IV antibiotics pretty much near the beginning of the treatment. The West Coast docs, though, generally tended to go with more oral antibiotics. All right. And so I think over time, most of us have probably migrated back to doing more oral than IV. What my experience says is that oral antibiotics work about 85 to 90% of the time. IV antibiotics work about 90 to 95% of the time. So there's a 5% difference, but they come with a lot of risk. Okay, there's financial risk because insurance companies often won't pay for them. There's the risk of you have to have an IV line left in place, a PICC line, or what we call a central line in the big blood vessels. And those can tend to get blood clots forming on them that break away, float into your lungs, and cause something called a pulmonary embolism where they kill off part of your lungs, all right? And there's a risk that can happen with your IV antibiotics. The other risk of IV antibiotics is getting an infection in your bloodstream because that IV line hanging out of your chest or out of your arm is a source for getting potential infection. So when we look at the risk of doing PICC lines over a course of about 3 to 6 months, about 15% of people will develop a PICC line or a central IV line complication and have to have it pulled out, which could be a blood infection or could be a pulmonary embolism. And so for the majority of people, that risk is not worth it for a 5% difference over oral antibiotics. I think the reality is there's not much difference, actually. Okay, anyhow. Thanks for your question, TJ. Good luck to you. Hello, Kim. Let's see. Hi, Dr. Ross. Thank you again for all you do in the Lyme community. You're welcome. Our daughter just received her mold test results from Great Plains. Her ochratoxin A was slightly above normal, normal being less than 7.5 at 9.48. But her multiple mold species was 87.24 with normal being 25.1. Want to start her on GI detox. Do you think this will be sufficient to start tackling her high mold? She has been treating her Lyme, Bartonella-review as well as yeast with good results, but her fatigue is still crushing. And I'm wondering if it's the mold that has been holding her back. So it could be the mold that holds her back. So there's mold toxicity and Lyme and co-infections can all look the same. They have similar symptoms, right? And the reason is that Lyme, Bartonella-review, Lyme and the co-infections trigger your white blood cells to make cytokines. Your mold toxins that are in you are also triggering your white blood cells to make cytokines. Cytokines are good and bad. On the good side, increased cytokines cause more white blood cells to be made. They draw the white blood cells to where the infection or the toxin is, and they help them work better. That's all good. But when the immune system is having a hard time dealing with these problems and getting rid of these problems, it'll work harder and harder and make more and more cytokines, and eventually can make too many cytokines, okay? And too many cytokines can lead to brain fog, body pain, low energy, hurting all over, poor thinking, hormonal dysfunction. All those things that we see as part of Lyme disease are really excess cytokines. And they're the same thing that happened with mold toxicity, which is excess cytokines. So could the mold toxicity be something that's holding her back? Yeah, could be. Could be. You'll have to see. GI detox is something I would work with in a situation like this with my patients. I definitely would suggest talking with your doctor to see what they think would be the better way of going, but it's a reasonable thing to try here too. Okay. All right. Good luck to you. Hello, Susan. Let's see, Dr. Ross, thank you so much for what you do. You're welcome. Your information has helped me immensely. I'm glad to hear that. That actually warms my heart to hear that, because that's why I put all that stuff out, is to help people. So thank you for giving me that feedback. I have Lyme and Bartonella. It took 4 years to diagnose, and I did 13 months of pulsing antibiotics with no success. I have been doing your herbal Lyme treatment for a month, and I'm planning on adding the Bartonella treatment. Can I take curcumin, otobarbart, cat's claw, hutania, cidacuda, capri plus, and cinnamon clove oregano all at the same time? For example, all of them once in the morning and once at night. I take probiotics, vitamins, and baby aspirin. Thanks. Yeah, you can do that. You can take all of those things at the same time in the morning and at night. That's what I do with my patients in my practice, and they tolerate it fine. The only caveat is make sure you're taking your probiotic away from your herbal antibiotics. Okay, that's the only thing. And you're taking your probiotics in the middle of the day. So yeah, sounds like a reasonable combination to me. Okay, good luck to you. Oh, one thing I want to say. I know that a number of my colleagues, including GemSec in Washington, D.C., like to pulse antibiotics for Bartonella and Babesia and for Lyme. Now, I think for Lyme, it makes sense. Lyme is an extremely slow-growing germ, and basically what the idea behind pulsing is to, as you stop the antibiotic, some of the germs that have gone into hibernation or in persister state will come out of that hibernate or persister state, start growing, and then when you reintroduce the antibiotics again, they'll have a better chance of killing that growing germ, okay? And it makes sense for Lyme because Lyme is extremely slow growing. But it doesn't make sense for Bartonella and Babesia. And so often I'll wind up treating people that I know have seen GemSec before that just did not get anywhere until we started using continuous antibiotics. And the reason is Bartonella, for instance, replicates every 24 hours. So during that time period, when you're off of the antibiotic, the germ's coming back fast, okay, real fast. It's growing rapidly, okay? Same with Babesia. So There's some germs I don't agree with pulse. I don't like doing pulse regimens for Babesia and Bartonella just because of the time frame of how quickly they replicate, basically. Okay. All right. Thanks for that question. Good luck to you. Hello, Marie E. Well, see, Dr. Ross. Thank you so much for everything you do. You're welcome. If living in a basement that probably has mold, although not visible, as trying to treat Lyme and co-infections, would an air purifier be enough to eliminate mycotoxins and not get mold toxin illness? Or is this not enough and moving is usually necessary? Thanks, Dr. Ross. So the first thing I would see is, do you have mold toxins building up in you? I would even ask that question. So for instance, some of us can live in building full of mold toxins and never be bothered because we're one of the 75% of people that when exposed to mold, our immune systems break down the mold toxins and we don't have trouble. All right. But there are 25% of people that if you are living in a mold environment, you're going to accumulate mold toxins in you and then they start being a problem. So before moving out or getting air purifiers, et cetera, you may just want to do a test to see, have you built up mold toxins in you? And if you have, then I think it's a better thing to do is to get out of your mold environment. All right. Air purifiers can help, but they're more of a Band-Aid to getting out of that environment altogether. Okay. All right. Good luck to you. Hello, Jason. Let's see. I contracted Lyme, had bullseye rash 2.5 years ago, treated with a few weeks of doxy, things settled down. 2 months later, developed many severe neuropsychiatric symptoms and severe fatigue. After 2 years on the Live herbal protocol with very limited improvement, I'm now thinking it may be BART and or BABS and possibly Lyme isn't a problem due to not having a migrating pain issue. Do you find many patients can have BABS and BART along with Lyme all at the same time? Can you get all three Bs from the same tick, or does getting Lyme stir up dormant infections? If so, do you treat dominant symptoms infection first or all in parallel? If treating in parallel, do you have a go-to combo treatment plan or just try combining some of the individual plans? Okay, so it is possible that the tick that gave you Lyme gave you Bartonella and Babesia at the same time. All right. So there's studies from the East Coast that show, and I think these are New Jersey or Connecticut studies. I'm not remembering immediately off the top of my head, but it's one of the East Coast states. And what they were able to show is that of the ticks that carry Lyme, at least 70 to 75% carry one other infection, and at least 50 to 60% carry two other infections. All right. So out on the East Coast, the reason that people on the East Coast get so slammed with Lyme is they're being exposed from those ticks to multiple germs at the same time. And they get infected with multiple germs at the same time. So it's actually quite common to have somebody that has all three of the biggies, like all the biggies, Bartonella, Babesia, and Borrelia, which is Lyme. Okay. It's very common, actually. In terms of my approach, what I tend to do is I tend to go after Bartonella and Lyme at the same time. And once we start getting Bartonella symptoms under control, then I will add in treatment for Babesia and actually try to choose a treatment that will cover all three things at the same time, but only after we start getting Bartonella symptoms under control. The reason I do that is based on the observations of Burriscano. Burriscano, many of you may be familiar, is one of the pioneers of Lyme disease treatment in this country. And he taught a number of us how to manage Lyme disease. And what his observations were from his practice on Long Island is that if he tried to treat somebody that had Lyme, Babesia, and Bartonella first and only addressed the Lyme and the Babesia, it made it much more difficult to get over the Bartonella. That was his observation. And I frankly have similar observation to that as well too. Okay. Now I do break that rule sometimes. If I've got somebody that I think has all three germs, and they have
their main symptoms are raging Babesia symptoms, and that's taking them out of life, I may go after the Lyme and the Babesia first and then come back and get the Bartonella later, all right? But in general, on average, I'm going to go after a Lyme and a Bartonella first, okay? All right. So for instance, if you were to try to do a prescription regimen that's Lyme and Bartonella, you might want to do a clarithromycin or a doxycycline combined with fluconazole. Okay, fluconazole we tend to think of as yeast, but we know that actually from Johns Hopkins research that it's great against growing and persister Bartonella. And for the Lyme germ, it does a good job of picking up the cyst form of the Lyme. Okay, all right. And then to pick up the Babesia, if you're on a clarithromycin or a doxycycline as part of your Lyme or Bartonella treatment, then you would add in a Malarone, which could be a good way of going after your Babesia in combination with those two. Okay, so you could do it as a 3-drug regimen, 3 antimicrobial regimen to pick up those 3 germs. Okay, all right. Good luck to you, Jason. Hello, Karen. Let's see. What is an herbal equivalent to atovaquone? 2, I took terbinafine for toenail fungus and it cleared my sinuses and head. What did the terbinafine clear up? Mold, candida? All right. So I'll make a comment about the terbinafine first. So if you have intestinal yeast overgrowth, and terbinafine could have handled intestinal yeast as well too, that intestinal yeast that you have growing will sometimes activate the mast cells, immune cells that line your intestinal tract, and they'll start releasing histamines. So those histamines then get into the bloodstream. They go up to the nasal area and even into the lungs. And up in the lungs, they can sometimes trigger asthma. And up in the nasal area, they can give a lot of congestion. So generally, if I have somebody that has lifelong asthma or lifelong sinus problems, and we clear yeast with either a terbinafine or a diflucan, whatever we're doing, often you can get all this stuff to clear up, and sometimes even their lifelong asthma will go away too. So I tend to think of that as not being from mold, but rather from probably relative intestinal yeast overgrowth. Okay, that can be a symptom of that. All right. And then in terms of atovaquone, so atovaquone is an antimalarial that we use to treat Babesia, that is either found by itself as a product called Mepron, is the thick yellow liquid, or atovaquone is in the product called Malarone, which is a combination of atovaquone and a quinine medicine called Proquinil. Okay, is there anything equivalent to it? I wouldn't say equivalent. I tend to think of atovaquone as probably being a little bit stronger than the herbal options. But the herbal option that I think comes the closest would be Cryptolepis. So the main 2 things we can use for treating Babesia in the herbal world are Cryptolepis, artemisinin. There's something also called Alcornia. And if I were to rate them, I would put Cryptolepis stronger than artemisinin, stronger than Alcornia. Okay. Pseudocuta might also help with Babesia, but I would put that even at the 4th level of strength, basically. So if I'm going to try to start something herbally to treat Babesia, I'm often going to go with Cryptolepis, and I go very high dosing on that. I usually use 5 milliliters 3 times a day, and it's going to take about 4 to 5 months to get it under control. Okay. If I want to add and make it even stronger, I might add artemisinin to that. But usually I'm not going to do it for a couple months. I'm going to try to see where we get with just using the Cryptolepis by itself. And often that can be enough. All right. All right. Good luck to you. Thanks for the question. Let's see here. Hello, Steve. Let's see. I recently came across the book, The Homeopathic Treatment of Lyme Disease by Peter Alex. Have you heard of it? Very hopeful stories from Europe. I haven't heard of it, that book. I do have a number of my patients that have homeopathy as part of their treatment. I'm not prescribing it, but they work with homeopaths. I think the role of homeopathy is that it's supportive, but you still are going to need to do something to kill the germs. That's been what my experience is. Okay. All right. Thanks for bringing that to my attention. I haven't heard of that book. I'll have to look into it. Hello, Gemma. Let's see. Hi, Dr. Ross. Which of the two Lumbrokinase products in your store is best, please? Also, what is an acceptable distance to take Malarone away from rifampicin, please? Is 1 hour after okay? Thank you. So Lumbrokinase in my store, there's a product made by Allergy Research, which is a 16 milligram per capsule Lumbrokinase, okay? And then the other product is a product made by Candida RNA, which is called Baluki. And Baluki is a 20 milligram pill. In my experience, I don't see any difference in how they work. I'm either going to have a person dose 16 milligram Allergy Research pills, 1 pill twice a day, or the Baluki 20 milligram Lumbrokinase pill, 1 pill twice a day. And I see similar results. I generally have people go with the Lumbrokinase by Allergy Research because it's cheaper, all right? And I just don't find a difference in the relative effectiveness of those pills, okay? All right. And then, generally, I guess what I would say here, Gemma, is I don't like using the combination of rifampin and Malarone. I think the rifampin decreases your absorption of the Malarone, or the atovaquone and the Malarone. Hold on just a minute. I'm going to look that up real quick. I guess I'm wrong about that. I take that back. I think you'd be okay doing it if you take it at least an hour apart. All right. Thanks for that question. Good luck to you. Hello. Oh, I think I answered this one earlier, Marie. Let me get rid of that. Hello, Frank. Let's see. I live in a hot zone for ticks. Do you have any cost-effective remedy for treating my backyard? It's approximately 1 acre. So that's a hard one. So first of all, you may want to make sure that when you're out and about in your yard that you're using a tick repellent on you. For that, I like using something called picaridin. It does not have any of the CNS bad side effects that DEET has and can work just as well, okay? So picaridin is Picaridin. You may also want to think about getting your clothing, spraying your clothing with something called permethrin and letting it dry on there. And that acts as a repellent that will actually go through multiple washes. You can wash it multiple times and it will still hold on there, okay? One other thing you could look at doing is so keep in mind that rodents can sometimes carry ticks as well too. And the one way that you can kind of combat the rodent population in your yard and the ticks that they carry that might have Lyme is to basically take toilet paper rolls, the cardboard tubing, and put cotton or some kind of stuffing in the middle of it and saturate those in permethrin. Okay, and then what happens is that the varmints, if you will take that cotton out of those, bring it back to their nest and pad their nest with it, and then you're basically killing the ticks and repelling the ticks in those areas as well too. So that's another way to do it too. Beyond that, I don't think I have any other good ways for you. All right, good luck to you. Hello, Shannon. Let's see. Good evening, Dr. Marty Ross. Good evening back at you. Let's see. Thank you for the webinars. Why do I feel really bad right before a bowel movement? Then I feel better. Does this mean my body is releasing toxins? Also, if you have a Bartonella-Babesia, do you have to treat Babesia first? Can you totally heal from Bartonella after having it for 10 years or more? So yes, you can heal from Bartonella after having it for 10 years or more. I answered part of your question earlier by saying I would go after Lyme and Bartonella before going after Babesia. And then, so if you missed that from earlier tonight, if you're listen back to the recording tomorrow when I release that, okay? And then, I honestly don't know why you feel really bad. I mean, it's possible that there is some kind of toxin buildup that you're releasing when you have the bowel movement. Beyond that, I'm just postulating that. I honestly don't know why. Okay. All right. Good luck to you. Thanks for the question. Hello, Nicole. Let's see. I've been put on erythromycin, but have an almost constant unpleasant bitter taste in my mouth. Is this a common side effect? Does it go after treatment has finished? And are there other commonly prescribed Lyme antibiotics don't cause this? All right. So a very, very common side of, well, not common, but about maybe 5-10% of people, when they're on clarithromycin, get a bitter metallic taste in their mouth. And some people, it becomes so foul, it messes up your food taste, that tasting of food, that people just want to be off of it. So in a Lyme treatment, clarithromycin is part of a family called the macrolides, which work in a similar way to what the tetracyclines do. So the macrolides and tetracyclines we use because they will treat spirochetes living. So the Lyme germ has multiple forms. Okay, so it's a corkscrew-looking thing. You probably see pictures on the internet. That's called a spirochete. There's also a microscopic cyst form of the germ, and the spirochete can morph into the microscopic cyst form and then back again. All right. And then there is another way that the germ looks, and it's called an L form. The L form basically loses its covering and moves to the inside of cells. So the L form is your intracellular kind. Macrolides and tetracyclines can treat the spirochete living outside of cells and can treat the intracellular L form of the germ. For the cyst, you often have to take something else, like a grapefruit seed extract might do that, fluconazole might do it, tinidazole might do it, but they don't do anything for that, okay? So your alternative to clarithromycin is either the other macrolide, which is Zithromax or azithromycin, or the tetracyclines, which would be minocycline or doxycycline, okay? And sometimes that's what I have to do with my patients, just switch up the treatment because of that side effect of that, unfortunately. All right. Listen, everyone, I am in a borrowed room here tonight, and I have to be out of here within 10 minutes. So unfortunately, I'm going to need to close up here about 10 minutes earlier. I am still in Austin, Texas this week, and next week I will be back up at my Seattle office, and we can go as long as we want to from there. So yes, I'm in the, many of you may have heard, we're having a big, huge ice storm. So I was glad that I was at least able to get in here today. But next Wednesday's webinar will be from Seattle, and the one after that will be from Seattle as well too. And we'll be able to go a whole hour and a half then. So it's been good to be with you here tonight. I do look forward to visiting with you again next week. So keep an eye out in your email tomorrow morning, somewhere between probably about 9, between 9 and 9:30 a.m. Central Standard Time. I should have a synopsis of the recording put together and the video edited of tonight's webinar and send you an email announcing that they're ready. In that email tomorrow, you'll be able to sign up for the next series of webinars. And if you like what we did here tonight and you think others would find benefit, I appreciate if you would share the emails tomorrow morning with them as well, too. So more people can find out what we're doing here. All right. Good night, everyone. Good being with you here tonight.